Good evening, guys. I have discussion B for you. Now, this discussion, we're discussing the future of small hospitals in America. Okay? From the budget cuts that Trump is doing, we're going to discuss the future of small hospitals in America. That's tonight's B. So please join me in my presentation I made for you. Here we go. Title: Rural Hospitals or Rural Healthcare Summit. Future looks grim for rural hospitals. Medicaid cuts threaten small hospitals. Major Medicaid cuts over $1 trillion are set to take effect between 2026 and 2028 as part of President Donald Trump's One Big Beautiful Bill. A $50 billion carve out for rural hospitals is included, but experts say it's insufficient to meet their growing needs. Expert panel insights. The summit featured voices like Dr. Tom Dean, retired physician and former president of National Rural Health Association. Kevin Stansberry, CEO of Lincoln Community Hospital in Colorado. Jean Lambrou, Director of Healthcare Reform for the Century Foundation. All agreed that rural hospitals are being forced to do more with less, which is not sustainable. Shift toward telehealth. Hospitals are increasingly turning to telehealth and virtual care to adapt. However, reimbursement rates of these services remain low, threatening the viability of this shift. Broader implications. Jean Lambrou warned that this isn't just a rural issue. Urban hospitals may also feel the ripple effects of these funding challenges. If you'd like, I can break down what this means for your local area or explore how telehealth might evolve in response. The article outlines several serious impacts on rural hospitals. stemming from upcoming Medicaid cuts and broader systematic challenges. Okay, guys, we're gonna get into financial strain next. Financial strain over 1 trillion. Medicaid cuts are expected between 2026 and 2026 and 2028. Although a 50 billion curve out is designated for rural hospitals, experts say it's not nearly enough to offset the damage. Operational challenges. Rural hospitals are being forced to do more with less, leading to a staff burnout, reduced services, and potential closures. Many facilities are already operating on razor thin margins, making them highly vulnerable to funding shifts. Telehealth limitations. While telehealth is expanding, low reimbursement rates make it financially unsustainable for many rural providers. This limits access to care for remote communities that rely on virtual services. Ripple effects beyond rural access. Experts warn that the collapse of rural health infrastructure could impact urban hospitals too, as patients migrate or emergency services become strained. If you'd like, I can help explore what this means for rural communities in Pennsylvania, or look into how local hospitals are preparing for these challenges. States are responding to the sweeping Medicaid cuts in dramatically different ways, shaped by their political leadership, budget, and budget flexibility, and reliance on federal funding. Here's a breakdown of how it's playing out across the country. Blue states, strategic delay, and political messaging. Many Democratic led states are holding off on immediate action, choosing to blame Republicans for the cuts and wait to see the full impact before making budget changes. Okay. Next page. legislators in these states have already adjourned for the year. When the cuts were passed, limiting their ability to respond quickly, states like New York and Pennsylvania have published detailed estimates of coverage issues and financial impacts, including projections by county and congressional district. Red states rolling back expansions. Some Republican-led states, such as Ohio, are preparing to roll back Medicaid expansion programs that were previously supported under the Affordable Care Act. These states may be more aligned with the federal policy direction and are adjusting their programs accordingly. State-specific estimates and planning. Wisconsin included both quantitative and qualitative assessments of the cuts affected on how they might affect coverage and hospital operations. States that rely heavily on provider taxes to fund Medicaid, like many in the Midwest, faced immediate pressure as the federal bill phases down the allowable tax rate from 6% to 3.5% by 2032. Alaska, which doesn't use provider taxes, will see minimal immediate impacts. Highlighting how state financing models influence vulnerability. If you're curious about how Pennsylvania specifically is preparing, or what this might mean for local hospitals, health services, I'd be happy to dig deeper. The long-term impacts of the upcoming Medicaid changes are projected to be profound and far-reaching, affecting not just healthcare access, but also broader economy and state budgets. Here's a breakdown of what experts anticipate. Healthcare system disruption. Hospitals could lose $32 billion in revenue by 2026 alone, with rural and safety net hospitals hit hardest. Like I said, folks, small hospitals are going to get hit first. Uncompensated care cost. When when hospitals treat patients who can't pay, are expected to raise by 6.3 billion, straining providers, office-based physicians, and home health care providers may see billions lost in revenue, leading to service reductions or closures. Coverage loses and patient impact losses and coverage losses and patient impact. If states reverse Medicaid expansion, up to 11 million people could lose health care or health insurance, work requirements, and reduced federal payments could force states to cut enrollment or services, especially in expansion states. Economic fallout. Joint report predicts 1 million job loss across healthcare and related services or sectors. State economies could shrink by 113 billion in GDP in 2026 alone, with 8.8 billion in lost tax revenue. The ripple effects would hit not just hospitals but also local businesses and government services. State budget pressure. States that rely on provider taxes to fund Medicaid will be squeezed as the allowable rate drops from 6% to 3.5% by 2032. This forces states to either find new revenue sources or cut services, both of which carry political and economic risks. These changes aren't just numbers, they represent real shifts in how healthcare is delivered and funded in America. If you'd like, I can help you explore how Pennsylvania specifically might be affected, or what local hospitals in Pennsylvania are doing to prepare. Pennsylvania is bracing for major disruptions due to upcoming Medicaid cuts, with consequences that could ripple across healthcare, employment, and state financed finances. Here's how the Keystone State is expected to be impacted. Give me 1 second, guys. Coverage losses. 310,000 Pennsylvanians are projected to lose Medicaid coverage due to new work reporting requirements and more frequent eligibility checks. Okay, an additional 270,000 residents could lose coverage if tax credits for Penny, the state's health insurance marketplace, are not renewed. Rural hospitals at risk. The cuts could jeopardize rural hospitals, especially in areas like Meadville. Medicaid patients make up a significant portion of the population. Reduced federal funding means hospitals may face closures or service cuts or reductions, threatening access to care in underserved regions. Economic fallout. Pennsylvania ranks fourth nationally in potential job losses due to Medicaid cuts. Estimated 42,000 jobs could be lost in 2026, including 22,000 direct health care positions. The state could also see a drop in economic activity and tax revenue, compounding budget challenges. Higher costs for patients. Starting in 2027, Medicaid recipients will face hold on. Six-month eligibility redeterminations. Higher out-of-pocket costs for treatment by 2028. Reduce retroactive coverage, making it harder to get reimbursed for past medical expenses. These changes could reshape Pennsylvania's healthcare landscape, especially for low income and rural residents. If you'd like, I can help explore what this might mean for Meadville specifically, or how local hospitals are responding. Low income residents are likely to respond to the upcoming Medicaid changes with a mix of confusion, hardship, and give me 1 second, folks. Adaptation. As the new policies introduce significant barriers to maintain coverage, here's how experts expect people to react and cope. Administrative overload. Starting in 2026, states that conduct eligibility redeterminations every 6 months, which means residents will need to repeatedly prove their eligibility for or risk losing coverage, even if they still qualify. Many low-income individuals may struggle with paperwork deadlines or lack internet access leading to unintentional disenrollment. Work requirements and coverage loss. By 2027, most Medicaid recipients aged 19 to 64 will need to work, volunteer, or study at least 60 or 80 hours per month to keep the coverage. This creates a huge burden, especially for people with unstable jobs or gig work, caregivers, those with undiagnosed or undocumented health conditions, even those exempt, e.g., patients or parents of disabled children, may face confusion or delays in providing exemption status. Mental and physical health risks. Losing coverage could mean delayed care, skipped medications, and worsening chronic conditions. Behavioral health services, often funded by Medicaid, may become less accessible, increasing stress and instability. Community level response. Residents may turn to free clinics, charity care, which are already stretched thin for care guys. Local nonprofits for help navigating new requirements. State advocacy groups pushing for exemptions or legal challenges. Economic trade-offs. Some may reduce work hours to qualify for exemptions, while others may take on unstable jobs just to meet the threshold, both of which can worsen financial insecurity. In short, these changes could force low-income residents into into a cycle of bureaucratic hurdles and health risks, with many relying on community support just to stay afloat. If you'd like, I can help identify local resources or explore how advocacy groups are responding. Okay, guys, I did this one just for people's FYI because it is coming down the pike for people's services, because that is one of my pet peeves when a senior or disabled person loses their coverage for health care. That is the one reason why I started this channel also, is for people's FYI about medical things that I'm certified in. Okay, so with that being said, Gator Wellness, take care, folks. I might come back on with C in a few minutes. So I'll see you guys for C shortly. For now, Gator Wellness, take care, folks.